A study presented at the European AIDS conference showed that people with HIV who've had COVID-19 then have a higher risk of having cardiovascular disease. I spoke to Dr Raquel Martin Iguacel to find out more. So the first thing I wanted to ask, could you just sum up the main findings of your study?
Yeah, we found that COVID-19 was associated with a 35% increased risk of cardiovascular events in people living with HIV in the subsequent year, especially in the first half a year after COVID-19.
So what's the biological link between COVID and cardiovascular disease?
Okay. We know that in the acute phase, many viral infections produce an increased risk of cardiovascular disease in the acute phase of the viral infection. But here we see that this effect continues after the acute phase. So what is the reason for that? We don't know. It could be like, for example, a hypercoagulability effect. It could be some inflammation. It could be like direct viral effect on the endothelial cells. So we don't know yet exactly what are the mechanisms.
And is this something that's seen in the general population, or is it specific to people with HIV?
Yeah, it's something that it has been seen in the general population, so it's not specific for people living with HIV. In the general population has been shown that there is an increased risk both in the acute phase but also after recovery. So I think that the importance in the HIV population is that we know that they have an a priori increased risk of cardiovascular disease. So that's why I think that it's important to highlight that is also found in people living with HIV.
So what should people with HIV and their doctors be doing with this information?
Yeah. First, I think that it's important vaccination, COVID-19 vaccination as prevention, so this is an important thing, and as well to have focus of risk factors, other risk factors for cardiovascular disease, so like diabetes, hypertension, all these things that we look at, so it's important to have control of these risk factors in this population.
So are you saying that maybe if someone's had COVID, they need to be thinking a lot more about the health of their heart?
Yes, I would say so. Like at least in the short term, we don't know this risk, how long it continues. We know that we see it the first year, but I think that after COVID, maybe to be aware about these risk factors, cholesterol, diabetes, tobacco, especially in after COVID.